After 40, sexual health for men is not a mystery of aging but a readable report card of circulation, nerves, hormones, sleep, and daily habits. So today we rebuild it step by step with simple moves that actually work. Because sexual function is connected to whole body health, we will move in a clear order. First, we will understand what an erection needs every single time. Next, we will shore up circulation and metabolism as the foundation. Then, we will audit medicines and hormones with care. Finally, we will layer habits that protect desire, comfort, and confidence. This approach avoids quick fixes that fade and chooses lasting fixes that compound. Before we move forward, subscribe so you learn each new lesson as it builds on the last, and so this work stays part of your routine. To start on firm ground, an erection is a teamwork event between blood vessels, nerves, hormones, and a calmer mind. Blood must flow in and stay in. That requires healthy arteries that can relax, healthy veins that can hold, and flexible, smooth muscle inside the erectile tissue. Nerves must send a clear message from the brain and spinal cord to the pelvis. Hormones such as testosterone and thyroid hormones set the stage for desire, energy, and arousal speed. A calmer mind helps the signal rise above noise because anxiety, fear, and distraction create pressors that constrict vessels. No single player wins the game. When men solve only one piece, such as a pill without a lifestyle-based approach, the result may be short-lived. When men address the whole pathway, results last. Because the pathway is shared with the heart and brain, erectile changes after 40 often signal that the vessels want attention. The same cells that line the arteries of the heart and brain line the small arteries of the penis. If those cells are stiff from high blood pressure, high lipids, smoking, or long-standing high sugar, the earliest clue may appear in the bedroom. That is not a cause for shame. That is a gift of early warning. When you improve blood pressure, improve lipids, walk daily, stop tobacco and steady sugar, you support erections and protect the heart and brain at the same time. Think of this as one fix, two wins. The fix you apply today helps tonight, and it also helps your future self avoid a heart attack and stroke. With that frame in mind, the fastest way to improve performance is to remove the blockers that quietly lower it. Some blockers live in the pillbox, others live in the grocery cart, others live in the calendar where sleep is too short and stress is too long. You will see that removing a blocker is often easier than adding a new pill. When a blocker leaves, your own biology does more of the work with fewer side effects. Now we name the biggest hidden blocker first, which is medication side effects that were never explained to you clearly. Several common medicines can reduce desire, delay or prevent an erection, or interfere with orgasm. Examples include certain blood pressure drugs, several antidepressants, some seizure medicines, strong pain medicines, and a few medicines that affect hormones. Alcohol in higher amounts also lowers performance and numbs sensation. The fix is never to stop a medicine on your own. The fix is to bring a complete list of prescription drugs, over-the-counter products, and supplements to your clinician and ask a direct question about sexual side effects. Often, there is an alternative option, a dose change, or a timing change that protects both your primary condition and your sexual health. If this section speaks to you, tell me in the comments which class surprised you most, because that will help other men recognize their own pattern and start a conversation with their clinician. Because sugar and nerves are tightly linked, steady glucose is the next key lever that brings function back. High sugar over time injures small vessels and the small nerve fibers that carry sensation and control smooth muscle tone that can show up as weaker erections, delayed ejaculation, or reduced sensation. The encouraging news is that better glucose control supports repair and improves function. You do not need perfection, you need direction. A few months of steady steps can translate into more reliable arousal and a more comfortable sensation. If you live with diabetes or are on the road toward it, the sections on food, movement, and sleep will give you practical steps you can use this week. Since plumbing and performance live side by side, lower urinary symptoms and prostate changes can affect how you feel in the bedroom. A slow urine stream, nighttime urination, or urgency can pull attention away from intimacy and lower confidence. Some medicines for urinary symptoms relax the bladder neck and can cause semen to move backward into the bladder in a harmless process called retrograde ejaculation. Other medicines that shrink prostate tissue can lower semen volume and sometimes reduce desire. Procedures can help flow but may carry sexual side effects, especially with more invasive options. None of this means you must live with poor flow or poor function. It means you and your clinician should choose treatments that match your priorities and that you understand the trade-offs. Good sleep from fewer nighttime trips can raise desire. Good flow can restore confidence that balance is possible. As many men ask about quick results, we should talk about medicines for erections and how to use them wisely. There is a class of medicines that helps more blood stay in the erectile tissue by supporting a messenger called cyclic guanosine monophosphate. They often work best when taken on an empty stomach, with enough time before activity, and with relaxed expectations. Common side effects include headache, facial warmth, nasal stuffiness, and indigestion. The critical safety line is this: do not use these medicines together with any nitrate drug for chest pain or with certain recreational inhalants. The combination can drop blood pressure to dangerous levels. If you ever have chest pressure, shortness of breath on exertion, or new exercise intolerance, pause and ask for a heart review before you use any of these medicines again. When used with good judgment, they support one part of the pathway while you work on the other parts. Because hormones are the orchestra that sets the tone, it helps to test wisely instead of testing everything. When low desire is the main issue, morning blood work on 2 separate days for total testosterone is reasonable. In some men, a calculation or direct measure of free testosterone is helpful, especially if there is a high protein binding state or borderline results. Checking prolactin and thyroid-stimulating hormone can uncover endocrine causes for low desire or low energy. When erection mechanics are the only concern and the desire is steady, broad hormone testing often does not change the plan. If a result suggests low testosterone, your clinician will look for explanations such as sleep apnea, obesity, high prolactin, pituitary disease, iron overload, or some medicines. Fixing the cause can be as important as replacing the hormone. Since many men are curious about testosterone therapy, let us set clear expectations and clear cautions. Testosterone therapy is designed to treat confirmed deficiency with consistent symptoms and low morning levels. It can improve desire, energy, and mood in selected men and can protect bones. It is not a shortcut around sleep, food, movement, and stress care. It is not a fertility treatment for men with primary testicular failure, and it can reduce sperm production while you take it. Monitoring is essential. Your clinician will check blood counts to watch for a rise in hematocrit, will assess prostate health with shared decision-making, and will tailor dose and form to your goals and safety. Men with certain cancers, uncontrolled heart failure, or high-risk clotting conditions require special caution. When used for the right reasons with the right follow-up, therapy can be part of a broader plan, not the whole plan. As the nervous system and the bedroom are in constant conversation, mood, worry, and sleep deserve respect and a fair chance to improve. Depression lowers desire. Anxiety tightens vessels and reduces blood flow. Poor sleep lowers testosterone and makes arousal slower. These are not character flaws. They are signals that your nervous system is under strain. The fix is to bring skilled help. A therapist can teach skills to lower performance pressure and to improve communication with a partner. A sleep plan built around a regular bedtime, a wind down that does not involve screens, and a cooler, darker room helps more than most people expect. If you and your clinician choose a medicine for mood, be honest about sexual side effects early so dose and choice can be adjusted before frustration builds. A partner who understands the plan becomes part of the solution, not a source of pressure. Now we build the foundation that no pill can replace, starting with circulation and movement that fit a 40-plus body. Walking is first because it is simple, scalable, and proven to support vessel flexibility, insulin sensitivity, and mood. Begin with a daily block that you can repeat without soreness. Aim for a pace that allows talking but not singing. Add a short hill or a few stairs most days to nudge the heart and the legs. Build up gradually until you are stacking enough minutes each week to feel the difference in sleep and energy. Add light resistance work with bands or body weight 2 or 3 days each week to protect muscle, especially in the legs and hips. Muscle is your glucose sponge. More muscle means a smoother post-meal sugar curve, which means a healthier blood vessel lining. Consistency beats intensity at this stage. You should remember that food is a fast-acting lever for blood flow and sugar. Choose patterns that calm inflammation and keep weight honest. Build most meals from vegetables, beans or lentils, whole grains, lean protein, and healthy fats like olive oil and nuts. Keep added sugar low. Keep alcohol consumption modest or lower because it can numb sensation and disrupt sleep. If you carry more weight around the waist, a steady calorie deficit with higher protein and higher fiber helps preserve muscle while you lose fat. Many men fix dinner quality and forget breakfast and lunch. That is a mistake. A simple template for daytime meals prevents drive-through decisions and late-night snacking. Hydration matters too. Even mild dehydration can lower energy and reduce arousal comfort. At home, measure progress by how your belt fits and by how you feel at the top of the stairs, not by a daily scale swing. Since the bedroom is part of real life with work and family demands, timing and environment matter more than most men expect. Choose windows of time when you are less likely to be interrupted and when you are not overfull from a heavy meal. Choose a cooler room and reduce bright light because both lower distraction and help the autonomic nervous system shift toward relaxation. Plan for longer arousal time and treat that as normal, not as failure. Add more sensual touch and more warmth. Replace the idea of a perfect performance with the idea of a comfortable shared experience. When the pressure drops, the signal flows. Because curiosity about supplements is common, treat them with respect, not as shortcuts, and keep safety first. Some men reach for herbs that promise quick results. A few can interfere with hormones or medicines. Some prostate support products can lower a blood marker called prostate-specific antigen, which can confuse cancer screening. Others can raise blood pressure, worsen anxiety, or stress the kidneys. If you take any herbal product, bring the bottle to your visit. Agree on a plan with your clinician and a time frame to judge benefit and risk. If sleep is your weak link, a conservative dose of melatonin can help some men, but higher doses can lower morning alertness and may blunt libido in some people. Start low, reassess often, and do not pile products on top of each other without a clear reason. Good plans always involve partners. Invite your partner into the fix so intimacy becomes teamwork rather than a test. Explain the pathway in simple terms. Share that you are working on vessels, nerves, and hormones. Share that the timing and warm-up will be different by design. Ask what helps them feel comfortable and present. Agree to remove any pressure to perform on a deadline. When both people view intimacy as a shared health project, the outcome is better and the mood is lighter. If you want to support others in this community, tell me in the comments what one small change improved connection for you, because that will spark ideas for couples who are just beginning this reset. As you move from ideas to action, use a short clinic checklist so your visit leads to a focused plan. Write down your main goal in plain words. Bring a list of diagnoses in every product you take, including herbs. Ask for a blood pressure plan, a lipid plan, and a glucose plan that matches your numbers and your risk. If desire is low, ask for morning testosterone testing on 2 days with thyroid-stimulating hormone and prolactin. If flow or nighttime urination is an issue, ask which options protect both urinary comfort and sexual function for your priorities. If you are interested in an erection dysfunction medicine, ask for timing, food interactions, and a review of nitrate medicines so you know how to use it safely. If you bring this structure, your visit will produce a clear sequence rather than a guess. Because the fastest way to build momentum is to avoid common traps. Here are the mistakes most men make and the fixes that work. Stopping a blood pressure drug abruptly because you read that it affects performance is a mistake. The fix is to discuss a choice, a dose change, or a timing change that keeps pressure controlled and reduces the sexual burden. Assuming age alone is the cause is a mistake. The fix is to run a simple vessel and hormone screen and to build a realistic movement and food plan. Using alcohol as a relaxer is a mistake. The fix is to schedule intimacy during a window when you are rested and to use unhurried warm-up and breathing to relax the nervous system. Chasing many herbs at once is a mistake. The fix is to choose none or one, review safety, and reassess openly. Ignoring snoring or daytime sleepiness is a mistake. The fix is to get screened for sleep apnea because better oxygen, deeper sleep, and steadier testosterone change the entire pathway. With the traps in view, a 4-week tune-up gives your body and mind the chance to show you what they can still do. Week 1 focuses on the foundation. Walk every day at a comfortable pace for at least 20 minutes. Add a 5-minute hill or stair block every other day. Eat real food at each meal with protein and fiber present. Cut alcohol by at least half. Write your medicine list and your questions for your clinician. Week 2 adds muscle and sleep. Do 2 or 3 short resistance sessions with bands or body weight. Aim for a regular bedtime and wake time. Keep the room cooler and darker. Remove screens for 30 minutes before bed. Note your morning energy and your evening desire. Week 3 audits and adjusts. Review medicines with your clinician. Ask about safer alternatives if sexual side effects are present. If you and your clinician decide to try an erection medicine, Learn the timing and food rules and agree on a safety plan. If libido is still low and you suspect a hormone issue, complete morning testosterone testing with thyroid-stimulating hormone and prolactin. Week for personalizes. If urinary symptoms are front and center, choose a plan that balances flow and function. If mood or anxiety leads the story, bring therapy into the plan and revisit any antidepressant choice that may be adding sexual burden. If sleep apnea is suspected, take the next step in screening. By the end of week 4, you will have real data from your own life and a plan that fits you rather than a plan copied from a friend. Because pacing and patience matter, measure progress in ways that give you credit for the right things. Measure by arousal comfort, by overnight rest, by how your belt fits, by how steady your energy feels in the afternoon, and by how relaxed your shoulders feel before intimacy. The bedroom becomes easier when the day is calmer. When men stop measuring only by a single goal and start measuring by well-being and connection, the rest follows. Since safety belongs at the point of need, here are the moments when you should call for prompt care rather than pushing through. New chest pressure, new shortness of breath on exertion, or lightheadedness are reasons to stop and seek care. A painful erection that does not go away requires urgent attention. A sudden major change in erections with leg pain or cold feet suggests a blood flow problem that needs evaluation. Any use of an erection dysfunction medicine with a nitrate drug or with certain recreational inhalants is unsafe and must be avoided. If you have cancer, significant heart failure, or a clotting condition, and are considering testosterone therapy, that decision belongs in a careful conversation with your clinicians who know your full history. When in doubt, pause and ask. Safety first keeps the door open for progress tomorrow. To make this easy to film and easy to follow at home, I will now recap the plan in a clean sequence you can keep. Start with the foundation because the body rewards fundamentals. Walk daily, add small muscle work, and steady sleep. Choose real food with protein and fiber at each meal, keep alcohol lower, and drink water. Audit medicines with your clinician to remove side effects that do not serve you. Use erection medicines wisely and never with nitrates. Test hormones when the story points that way rather than by habit. If therapy for low testosterone is on the table, follow a clear monitoring plan and know the cautions. Protect urinary comfort while protecting sexual function with clear choices. Bring your partner early and treat intimacy as a shared project. Ask for help when red flags show up. Measure progress in real-life benefits. Repeat what works and drop what does not. That is the blueprint. You deserve a strong start, so here is a simple day you can try as a reset within the next 48 hours. Wake and drink water. Walk for 20 minutes outside if possible. Eat a protein-rich breakfast with fruit and a handful of nuts. At lunch, choose a large salad with beans or lentils and olive oil. In the afternoon, do 10 minutes of easy band work for the legs, hips, chest, and back. Eat a balanced dinner and stop food 2 to 3 hours before bed. Dim the lights an hour before sleep. Turn phones away, write down any worries, and breathe slowly for a few minutes in bed. Keep the room cool. This is not a perfect day. This is a human day. Do this twice each week for a month and you will feel the difference in energy, mood, and interest. As you continue, remember that confidence builds from small wins repeated, not from perfection demanded. You are not chasing a number. You are building a durable system. Vessel health improves with each week of steady effort. Nerves calm with better sleep, kinder self-talk, and therapy when needed. Hormones respond to the signal that you are giving your body that you are ready to feel better. Partners respond to honest conversation and a gentle plan. A body over 40 has history and wisdom. Treat it with respect and it will respond. Because this channel is a community of adults over 40 building real health, your voice helps others stay on track. Share one action you are committing to this week in the comments, whether it is a nightly walk, a lower alcohol plan, a medicine review, or a conversation with a partner about timing and warm-up. Choose one, post it, and return in 2 weeks to report what changed. Your progress will spark someone else to try. Finally, you now have a clear way to improve male sexual health after 40 because you know what the body needs and you have a realistic path to give it. You have a map of vessels, nerves, hormones, sleep, mood, and daily habits, and you have a 4-week tune-up to put the map into motion. You have practical safety lines and a clinic checklist that makes appointments useful. You have a way to measure progress that shows the truth rather than a number that discourages you. Take the next step today. Subscribe so you do not miss the next lesson, and pass this to a friend who needs a hopeful nudge.